Hi, everyone. Welcome back to the show. Today, I'm joined by Dr. Maria Colon-Gonzalez, a board certified family physician and the founder of Salud Revisited, a Houston-based practice focused on integrative and lifestyle medicine. Dr. Colon-Gonzalez helps patients who often feel like they've tried everything, people who have been multiple doctors, taken multiple medications, and still feel exhausted, inflamed, or simply not themselves. Her work focuses on identifying the root causes of chronic health issues using a combination of conventional medicine, lifestyle medicine, nutrition, and personalized care. Doctor, thank you so much for joining us today.
Thank you. Thank you for having me.
Doctor, I always like to start with people's story. What first inspired you to pursue medicine?
So, long story, but I will make it short and kind of like interesting or fun. Growing up, I was a sick child and I had, medical conditions that a lot of people would think that are more older people, diseases. So as a child, I grew up with asthma. I was in the hospital probably 4 times just during elementary school. So that's almost like one admission per grade. Then as I became a little bit older, so two things, and I think one of them actually started in elementary school, which was I was diagnosed with type 2 diabetes, which a lot of people, and especially right 30 years ago, we would have think of type 2 diabetes as being something more that affected kids. And then being a little bit older, my adolescent years, I started to develop back pain. And I have these like chronic conditions. Being a child, which it's kind of like weird, I started to do my own research online and I started to read a lot about nutrition. I was not eating the typical Puerto Rican diet. I started to incorporate different foods, more vegetables, and also do exercise, especially yoga. Yoga helped me a lot for my back pain. And the reason that I started to do this was because I was going to my doctors. I was going to physical medicine and rehabilitation. I was doing my physical therapy, and a lot of my symptoms were not getting better. I was still, as a child, and at that time, what I was told was like not eat sugar and use the candies that would have like artificial sugar, but that would only leave me with like a foggy brain, tired still. And as you know, all of those candies and things that had artificial sweeteners, a lot of them also would give me bloating, they would give me diarrhea. So it was really traditional medicine, and my doctors were not giving me a lot of the answers that I needed. And then as I pursue my own research, which I know that patients still do it, and sometimes it's good, but be careful with the research that you do on your own and your self-diagnosis and treatment. But it was really finding out that there were other healing modalities and other things that can really keep people healthy, that then I was like, oh, I want to be a doctor and help people.
Well, just kind of coming at this from my own personal experience because I heard you talking about sugar and artificial sweeteners. I can't have artificial sweeteners. I had a diagnosis of my own. For years, I had stomach issues and I couldn't figure out what it was, and I went and saw a gastro and had a colonoscopy and all that stuff. And then he's a pretty good gastroenterologist. I like him, and he eventually diagnosed me with lymphocytic colitis,
Mhm.
which I think is pretty rare. I'm the only person I've ever met that has it, and so there's certain things I can't drink. I mean, I can't have like Diet Coke. I can't have anything with artificial sweeteners in it. I can't have dairy. I can't have. Well, I'm not supposed to have alcohol, but I do. I'm also supposed to avoid caffeine, but that's tough for me too. But yeah, no, I mean, that's crazy that you mentioned that because that's artificial sweeteners. I used to like pound Diet Cokes in college like it was going out of style, and who knows, maybe that even like led to my aversion to it. For all I know, it
Right,
manifested later in life.
right. And I think that, as time has passed and we have more research, and like now we know that all of those like sweet and lows, and those, I'm not going to say brands, but all of those artificial sweeteners are really not beneficial for us.
Mm-mm.
And at first it was like, well, sugar is a problem, so let's use artificial sweeteners. And especially if you had diabetes. But now we know that it has a lot of other effects in our health. I don't recommend them to my patients, even if they have diabetes. I suggest other forms to have that sweet taste, which is really what we want and what we're looking for.
Does that include stevia as well?
So, yes, I do recommend it. I don't use it. The reason being personally because of the aftertaste. And I tell patients, these are other options if you don't like the aftertaste of it.
So once you were in traditional medical training, what did you start noticing about the way healthcare was being practiced?
Yeah, so I did medical school. I did my residency. When I was actually in second year of residency, that's when I started to become extremely very frustrated, and frustrated because of what? So I'm seeing all of these patients back to back, back to back. A lot of the times just for medication refill, what we call like medical inertia. We're seeing you, we're checking your labs, refilling your medications. That's all we're doing. And I was like, these people are not getting any better. We're just like giving them meds, giving them meds, giving them meds. I think that that's when I first started to feel burnt out or have compassion fatigue, whatever term you want to use. And I started to question, oh my God, is this what I want to do the rest of my life? Because it is actually pretty boring if you are just looking at labs for filling medications and staring at a computer and doing a lot of this computer work without connecting to your patients and actually talking to them. While I was in residency, I decided that I was going to pursue additional studies because part of what I realized was like, okay, I need to be able to do something that is not only seeing 30 patients a day back to back. And again, just refilling medications. So I did a faculty development and I was faculty at different programs, family medicine programs, for the first 5 years of being a physician, an attending physician. And it was in one of these institutions that I had a colleague that we were kind of like mentally aligned in ways that we practice. And she told me, you know what? You should really consider lifestyle medicine. At that time, she was actually in the first class that took the lifestyle medicine board, which was part of the American College of Preventative Medicine. It's not a traditional board where you sit down and do a residency, but you still have to take a test. And when I looked up what it was, I was like, wow, this makes a lot of sense because you you are going to get the tools to help people. There is a very fine line between imposed lifestyle and chosen lifestyle. That is a reality. Yet helping people and empower them within the constraints of their social determinants of health to make the healthiest choices and to realize that, yes, they do have power over some of those choices that they can make is absolutely important. So I did that training. And as I said, that training gave me a lot of really good tools in terms of helping people with nutrition, sleep, exercise, some of the things that people know that they need to do, but sometimes they don't do it. And most of all, not necessarily the knowledge of telling people this is what you need to do, because really that does not work with patients, but more so how can I have a conversation with you of meeting you where you are in terms of your readiness to change within your socioeconomic reality, right? And this is not necessarily that everybody needs to start eating organic. That's not what we're talking about. But and then what are the choices that you feel ready to do? And doing them one at a time and seeing the impact that that has on your health and the way that you feel in your body. And that really started to empower me and give me some hope that there is like a different way of practicing medicine. I strongly believe in lifestyle medicine, yet I also realize that it does have some limitations, right? There are patients that even if they're doing the right thing in terms of exercise and diet and they're sleeping, they're still having symptoms, they're still having illness. And then that's why I pursue then a fellowship in integrative medicine. And I also practice medical acupuncture, specifically Japanese, because I also believe that the more that we can help the body heal from the inside out, reduce side effects. Everything has side effects, whether it is supplements, whether it is medications, everything has risk, any intervention that we do. But the more that we can do it in a gentle way and reduce these side effects that it can have, then I tend to approach it that way. I am a strong believer in medical acupuncture. It helps for a lot of things. It is just very sad that the insurance only covers it for pain. But acupuncture is, yes, it's a treatment that you might need chronically. What I mean by that, for a long time. Yet it is very powerful. And again, it doesn't have a lot of side effects. So I decided to combine those things. And I believe a lot in mental health and your spirituality, which is not necessarily religion, but you as the person where you are. I think that sometimes in the traditional system, we either do not pay attention to mental health or spiritual health, or we might do inside a compartment and inside what we believe that it should be, or we just use it to put labels and diagnoses and not necessarily help people become empowered and know themselves better and take care of themselves from a position of empowerment.
I've always been really intrigued by acupuncture. I have tinnitus too, and I've actually heard people say that acupuncture might be an alternative method to maybe treat tinnitus. So I've really been intrigued by that. And I've talked to everyone I've talked to that's ever done it has had nothing but good things to say about it. What other, you said that insurance only covers it for pain. What else do you use it for if you're not just treating pain?
Right. So acupuncture can be really, really good for hormone balance. It is extremely effective for fertility, really good also to manage allergy type of symptoms, mental health, things like depression, your sleep, your anxiety. So acupuncture in the hands of somebody that understands the science can really help determine, okay, where in your body there are imbalances. And in Chinese medicine, this can be because of what we call your constitution. And it can also be affected by lifestyle things that you're doing. And they don't necessarily put the label of healthy lifestyle versus unhealthy lifestyle. It can be like you're eating too many cold foods. Right. And therefore, you need to balance that with warmer foods. So I think that acupuncture, again, can be very powerful to not only treat pain, but as well as respiratory conditions, mental health, GI symptoms, fertility, menopause symptoms. So it can be used for a variety of things. It has really good evidence for nausea, especially nausea associated with you having a surgical procedure. And there are European countries that they actually use acupuncture before you go into the OR. And then that reduces your need for having medications,
Wow.
having your procedure.
So I think I mentioned to you that I'm an attorney and I'm a criminal defense attorney. So anxiety is just, it's a hazard, a job hazard. It's just something that every criminal defense attorney that I know,
Mhm.
especially those that try cases like we do, has anxiety. So, I would be curious to see how effective that was
Yeah.
because I'm willing to try anything,
Yeah.
but yeah, no, I mean, I'd love to see that. I'm already making a mental note that I might even come see you.
There you go. Yes.
Yeah.
And we'll see how you respond. And I think that also the important thing for people to know with acupuncture is like certain medications that you need to take. for 2 weeks before you feel better. So with acupuncture, maybe you might feel a difference in your body with one session, but for you to start to feel like the effects of this is really working, think of it like 3 to 4 sessions. Give your body some time to can be because we're bringing balance into the body. And if you think about any system that you're going to bring balance into it, sometimes you have to move a couple of pieces before the ecosystem is in balance again.
A lot of people hear terms like integrative medicine, functional medicine, and lifestyle medicine, but they may not know the difference. So let me ask you this. How do you explain integrative medicine to someone who has never heard of it before?
Yeah. So, and maybe I can put it this way. So, when we think about lifestyle medicine focuses on specifically that, what your behavioral choices associated with health. And that is how you nourish your body, how you move, your sleep, your level of stress and stress resiliency, how you manage stress, because we were all going to be exposed to that. It does also look into your community and relationships because we do know that loneliness is the same as smoking. So it does look at that component, but it doesn't necessarily look into are these healthy relationships? Are these safe relationships? And what is the effect that the relationships is having on your mental health negatively or spiritually? Lifestyle medicine will also y- promote the reduce of um, risky substances, right? So we don't talk necessarily about, you're an alcoholic and that sort of thing. But if you're smoking, if you're consuming alcohol, we know that those substances have a negative effect in your health. Even alcohol, and even if you are doing little of it or you're not getting drunk, like some of my patients tell me, but still the use of alcohol will have an effect on your health. So compare that to, for example, in functional medicine, we definitely believe that the gut health is especially important. And as research has come, we know that that is, yes, associated with your choices of diet. We know that the diet and how you nourish your body will have a direct effect on your gut microbiome. And now we know that you have the same microbiome in other places of your body. So that is really important. And that is in a way similar, but with a different approach. Another similarity, but with a different approach, is in functional medicine, we might look at your detoxification patterns. And we are not looking at that because you're consuming too much alcohol or smoking, but we are all exposed to environmental contaminants, right? We live in this world where, especially like here in Houston, you might live close to a train track or close to one of the airports. We have the highways close to us. So those are all producing environmental contaminants that we all have a capacity to for our bodies to get rid of it in a different way. And some bodies need support getting rid of some of these environmental contaminants. Some other bodies do not because we're all not the same. So that is another similarity. And, when it comes to especially mental health that I really like, I think that one of the biggest difference is that we approach it from this perspective of root cause. That does not mean that we might not use medications like sertraline, right? Like your SSRIs, but we're really going to see micronutrient wise, like your B vitamins, where are they? Your vitamin D, the gut microbiome, which we know that is really related to mental health. And we're going to look at the best way that I can explain it to you is how is your body working at that tiny little cellular level and without necessarily putting things in compartment, but looking at those like little units of cell more as integrated and is everything working and communicating well. And
So, oh, I'm
yeah,
sorry.
go ahead.
Well, I was just gonna say, someone like me who's been eating poorly, really, for his whole life, and I'm 53.
Mhm.
making a switch and doing the right thing now restore that gut biome and get you where you need to be to correct everything?
Absolutely. We're never too late.
Okay, good. Because sometimes I'm like, man, I've been eating poor for so long. I mean, why even start trying to fix it? And like you said, I don't I don't get drunk very often, but I do drink
Mhm.
regularly, and I'm sure that also, has an impact on my mental health as well as my physical health as well.
Right.
And something I hear a lot of people say is my labs are normal, but I still feel terrible.
Mhm.
You work with patients who are dealing with things like fatigue, gut issues, stress, and hormonal problems. Why do you think so many people today feel chronically tired or unwell, even when traditional tests don't show anything obvious?
Yeah, I think it can be different from person to person. And what I mean by that, sometimes there is a little bit of a factors of the lifestyle. A lot of people, once you start to talk to them about, their consumption of alcohol, and this is just one example, how much they're taking, daily at night. A lot of people are like, I don't think that this is a problem because I'm not getting drunk. Right. But what we know is, your body. So, one, everybody metabolizes any drug differently. That's one. But two, what we know is, yes, that does have an effect on your body, especially at nighttime, which is when we tend to consume it more, especially in your liver, and then affects your sleep. Right. So there are things that have a cascade. So, part of it might be, your labs are not necessarily reflecting that there is a problem in your behavioral choices, but there is always a little bit of room up for improvement. And I think that the other thing is a combination of, in the traditional healthcare system, because people want to use their insurance to pay for all of their health care, then as a physician, a lot of what happens is the labs that are going to get ordered are labs that are traditional labs, the labs that your insurance will pay for. And sometimes that is not going to reveal the issue. I mean, that is absolutely true. So sometimes, you need to investigate a little bit more. I also feel that I do medical genomic testing, and a lot of the times I can find things that are genetically that are impacting your health and how you feel that are not going to be reflected in normal labs. And what I mean by normal labs is, the traditional labs that your PCP is going to order. So I think that there is a combination of when healthcare is provided within, and I'm using the word healthcare, even thought a lot of the times what we do in the traditional system is more sick care, right? We wait until something's really bad and then we try to fix it.
So, what are some of the most common underlying problems that you see?
Yeah. So I think that it is a combination of behavioral lifestyle and underlying issues. One with the gut. I think that we have focused so much on eating as a diet and eating like, oh, now is the trend of the fat free and the sugar free, and carbs are bad, and you have to eat all protein and carnivore. Really, what we have done, and then on top of that, we might be overusing antibiotics. That really what we have done is just really messed up our capacity to nourish our bodies how our bodies need and absorb the nutrients as our body need. So I think that that's a big component. I also feel that a big component is mental well being. And what I mean by this is you don't necessarily have to have a diagnosis of mental health, right? Or meet the criteria for, I don't know, depression. But the reality is that mental well being, right? When mentally and spiritually you're not in a good position and aligned, it will have a cascade of effects in your body because it's going to affect your neurotransmitters, it's going to affect your hormones. So then biochemically everything in your body starts to work differently. So I think that mental well-being is something that is a really big component. And the other thing is, especially when patients come to me, they have seen a lot of specialists, they have tried different medications, different things, and we're still like, nothing is working, nothing is helping me. These are patients that I really recommend medical genomic testing because then it helps us see from this genetic perspective, like, okay, what is it that maybe is going on that we haven't been able to diagnose without this test, that we can target treatment and then see how your body responds to it. And I think that that also makes a really big difference.
You've used a term once that I just want to clarify because I'm not sure I heard it right. Did you say medical genomic as in genome testing?
Genomics, yeah. And the reason being because so we're not testing genes. Like this is not like we're testing the BRCA gene, for example. We're testing it specifically for SNPs. So the best way that I sometimes explain this to patients is um, we can all have ham and cheese sandwiches. The difference might be that your ham and cheese sandwich has provolone and somebody else has Swiss cheese. Therefore, when you eat the sandwich, it tastes differently. So, what these SNPs do is within genes are variants, they're different. And therefore, then the way that that gene expresses themselves for taste, if you think about a sandwich, right, the taste is different, the expression or the function of it is different, then that is how it's creating maybe some problems or illnesses, right, that you are manifesting in your body. So it's not the same as testing you for a lot of people, what BRCA gene is related to breast cancer. We're looking at specifically at these variants within your genes and within your genome. So it's a little bit different.
So, one of the things you talk about in your work is the connection between stress, trauma, and physical health. For people who have not heard this before, can you explain how emotional stress or trauma can actually show up as physical illness?
Yeah, so there is a lot of research that has been done, especially with chronic trauma, chronic stress. And sometimes people think that this is just PTSD, right? But not necessarily, right? I think that, yes, somebody that is in an unhealthy relationship for a long time will have this chronic trauma exposure. Yet, you yourself said it, you are a criminal defense attorney. What is not only your level of stress daily, but also being exposed to stories of other people. And this has a name, and if I'm not mistaken, is secondary trauma or something like that, where you are not the one who receives it, but you are like the bystander, like happens with like EMS firefighters, right? Where you are just witnessing things that the way that your body responds, because trauma is really a bodily response, it tells you something is not right and this is not safe. Right. So
It,
trauma is not necessarily an event, but it is what happens in your body, like Dr. Gieber Mate says.
um, and I don't know who that is.
Another really good book is The Body Keeps the Score, right?
Oh, okay.
Yeah, so he is a psychiatrist out of UMass. I'm not sure if he's still practicing, but basically, he did a lot of research. And in this research, what it was found was specifically people exposed to what we call adverse childhood events. So, people that grew up either parents got divorced, physical violence, emotional violence, sexual violence, whether it was towards them or that they were witnessing. One of their parents was incarcerated, right? So there's these 10 things that we call adverse childhood events. But people that were exposed to a lot of this chronically, it is associated with higher degrees of obesity, autoimmune disease. Your pain perception is your threshold is lower. That means that what it's not going to provoke pain to me. is going to provoke pain to you, right? You're more sensitive to pain. We know that it's also associated with more like GI gut type of issues because, again, we have neurotransmitters in our guts that are associated with that. So, what we know is that people that are, think of people right now that are living in the war, right? This is like a chronic stress in their bodies. It does have an effect not only on their emotional health, right? And maybe they cannot sleep, but it will eventually have an effect on their physical health.
Kind of in the same vein, I've read a couple of articles. One was an article, and I forwarded it to my wife, so it's fresh in my head. And it was basically kind of along the same lines of what we're talking about. And it basically said that exposure to difficult people can actually make you age faster. Have you seen that article that I'm talking about? I saw it in the Wall Street Journal just a couple of days ago.
Yeah. And it's very interesting that they say difficult people, right? I think that any relationship in your life that is unhealthy, unsafe, and creates more negative effects rather than positive are going to have that effect on you, right? And in adverse childhood events, kids don't have any control. As adults, we do sometimes, but I think that that can be as simple as the relationship that you have if you're employed with your boss, right? So I think that that is right. Any person that makes you feel kind of like something, like something is not right, like that your body gives you this message of like, is going to, especially if it's chronic, right? If you're exposed to that person every day. Absolutely.
I will say, I'm part of the largest criminal, like local criminal defense bar in the country, HCCLA, Harris County Criminal Lawyers Associations, one of the big criminal defense bars in the country.
Uh-huh.
And it seems like, um, and maybe it's just anecdotal, but I felt like a lot of people who weren't necessarily old or of that age where they might die of natural causes, that there was a period there where I felt like I heard so and so passed away, and then I heard it again and I heard it again, people in their 50s maybe, or even younger who were dying. And it wasn't necessarily that they OD'd or whatever. It was more like, I don't know, maybe a heart attack or something. And I wonder if that just the constant barrage of, like you said, absorbing our clients' problems. Sometimes people who are looking at life in prison or, you know, having to try capitals. I don't do capitals. I never will. But people who have to do that kind of thing with people's literal lives on the line, I wonder if that can like accelerate the aging process and maybe even, God forbid, contribute to your early demise. And I read another thing. Take this with a grain of salt because this wasn't a Wall Street Journal article. This is just
Yeah.
something I saw on TikTok. But I thought, if I'm quoting it correctly, it said something to the effect of that our profession, that it can actually turn some of us into sociopaths and actually make you more effective as a lawyer if you are a sociopath, because you can kind of disconnect a little bit better, and be like, hey, I'm going to do my job, and I can't think about this person's life as much as, as I would, because you're just constantly exposed to it. And in order to be an effective litigator, especially in criminal defense, you kind of have to be able to turn it off. And maybe that's just a casualty or maybe even a benefit, I don't know, of the job. Being able to turn it off can make you more effective. I don't know that I'm there yet, but I definitely see the benefit.
Yes, absolutely. So, the body and the brain, they're very powerful. And I'm not necessarily a trauma psychotherapist, but definitely what we want to understand is your body and your brain are very powerful. They will try to keep you alive. And one of the ways that keeps you alive is we form compartments, right? And when we are in this constant survival mode, we will shut down the other things that are too overwhelming, right? When emotionally this is overwhelming, I will disconnect from it, even that it is the reality. And I'm just going to give a recent, more personal example. So recently I went to see my family back in Puerto Rico. And if you know anything about the story, Puerto Rico after Hurricane Maria, the issue with the electricity and the light system is like really bad.
I
And
remember.
being there, I started to notice how like my family was kind of like living and dealing with some things. And the best way that I could explain it is they're in survival mode, right? Because they're so overwhelmed with these external thing that they cannot control that they have just gone into survival mode and they're not even aware of it, right? So I definitely believe that that is what happens, in trauma. And, I don't think that necessarily is that you become like a sociopath. It's the same thing as a trauma surgeon that is on call and that, night after night comes the patient that was in a car accident that, they have to take to the OR, that they have to try to save their lives, that maybe they can, maybe they don't. And they start to like numb and detach from the emotional reality because sometimes what happens is I don't have, whether it is that you don't have the safe community where, and in medicine, sometimes this happens, sometimes not, but where I can go and say, like, this that just happens was shit. Right. And
Mhm.
I'm feeling sad. And, this gave me palpitations and that sort of stuff. And what we do know about trauma is that when you have a witness, and what I mean is the witness of another person, that you can be very vulnerable with your emotions, that can see that emotions and attune. It's not that they try to fix it, but they attune to those emotions. That by itself has a very positive and healing effect. And I think about the way that we live in this society. We go in so much of a fast mode. We might not have those relationships. We might not have not even the time. And then therefore that stays in us. And what we do is this is too hard. This is too overwhelming. I'm going to detach and then just try to live. That's really the best way that I can explain it.
Let's do some quick fire questions. What is the most underrated health habit people should focus on?
Oh, sleep, 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 sleep.
Yeah. No, that totally makes sense. What is one health trend people should be skeptical of?
Uh, I think that we need protein. We just don't, everybody needs 2 grams per, kilogram of body weight. Like, yeah, just be aware of that.
You're gonna upset some gym bros, I think. I know that's a new thing, right? Like, in the past, nobody really seemed to care about it. Now it's like you have to have, I've heard as high as 2 grams for every pound,
Yeah,
which for me would be, I'm 185. I don't know. My math is bad, but it's a lot. That's a lot of protein.
yeah,
Even
yeah.
1
And
gram.
then you just eat that and then you forget about all the other macronutrients and micronutrients.
What is one daily habit that has the biggest impact on long-term health? And you already said sleeping, so let's say another one.
Physical activity. Absolutely. Move.
And what is one thing you wish more patients understood about their own health?
That not everything that is out in social media or not everything that works for your significant other, for your family, for your friend is what you need. I think that one, you know, work with somebody that can personalize, treatment and diagnoses and all of that good stuff for you. And then the other thing is be open to, yes, have your health insurance. It's kind of like your home insurance, your car insurance, but know that that will not be all. And sometimes you do need to say, I am going to pay for the test or for the procedure or for whatever it is out of pocket. Have an out of pocket, however you want to call it, HSA, FSA, whatever. Have this is going to be to pay for health and not only sick care. I think that that's extremely important.
I think that's really good advice. Doctor, this has been a fascinating conversation. If people want to learn more about your work, where can they find you and learn about Salud Revisited?
Yeah, so the easiest way is online through my website, www.saludrevisited.com. And for those of you that need the spelling, Salud is SALUD Revisited, REVISITED.com.
Well, thank you again to Dr. Maria Colon-Gonzalez for joining us today. If you enjoyed this conversation, be sure to follow the show and share it with someone who might benefit from learning more about integrative and lifestyle medicine. And we'll see you next time. All right. Thank you. Thanks again. Bye-bye.